Hello, I'd like to talk about military benefits today. It doesn't matter if an individual served in active duty status, reserve status, or National Guard status. The military membership comes with some unique and valuable benefits. Today's military members are entitled to some unique and valuable benefits. They include benefits such as home ownership, education and training, and health care both while still in the military and after retirement. I am the grandson of a career military man, and my father also served in the military, but not to retirement. I've currently been in the military for just shy of 20 years. I've taken advantage of these benefits and seen my grandparents enjoy these benefits well into their senior years of life. I've been around the military for most of my life. Once upon a time I left the military, but I came back to it. I have seen the outside world and what it has to offer, but I prefer the military way of life and the benefits that come with it. First topic I would like to talk about is home ownership. I would like to talk about the home ownership program that are available to military members. All members, to include past, present, and retired, have access to these programs. I've personally used two of the Veteran Administration's home loan programs, one to purchase a home and one to refinance a home. Listed on the VA Benefits Home Loan Program website, there are several programs that are available to service members. I'd like to talk about two of them today, the Home Purchase Program and the Refinance Program, the ones I've used. The first is the Home Purchase Program, which helps military members purchase a home without having to put a down payment down or get a private mortgage insurance. The VA does this by guaranteeing a portion of the home loan. The member is then able to get the loan at a competitive rate with favorable terms. The second is a home refinance program titled Interest Rate Reduction and Refinance Loan. This program does not require an appraisal or credit underwriting. There are virtually no out-of-pocket expenses to the military member, or if there is, it's very minuscule. It allows the member to get into a lower rate, which in turn allows the member more finances for other expenses in their lives. The second topic I would like to talk about is education. The education benefits that come with being in the military, and where the program started and where they're at today. The education benefit is one of the most sought after benefits that the military has to offer. The Servicemen's Readjustment Act of 1944, which is commonly referred to as the GI Bill of Rights. This bill was a hard-fought political battle and almost never came to realization. According to the U.S. Department of Veteran Affairs website, college and home ownership were, for the most part, unreachable dreams for the average American. Thanks to the GI Bill, millions of who would have flooded the job market instead opted for education. In 1947, veterans accounted for 49% of college admissions. By the time the original GI Bill ended in 1956, 7.8 million of the 16 million World War II veterans had taken part in education training programs. In 1984, the GI Bill was revamped by former Mississippi Congressman Gillespie Montgomery. He assured that the legacy of the original GI Bill lives on. The bill has been known as the Montgomery GI Bill ever since. The VA continues to work with our newest generations of military veterans, and in 2008, the GI Bill was updated yet once again. It allows veterans who were on active duty service on September 11, 2001 or after improved educational benefits that cover more educational expenses. These benefits include providing a living allowance, more money for books, and the ability to transfer their unused educational benefits to a spouse or child. Now, if you transfer your benefits to a spouse or child, you have to give the military 4 more years of service, which is not a bad deal. Last topic I would like to talk about is healthcare. The Department of Defense healthcare system is called TRICARE. TRICARE is an enormous and very complex healthcare system. There are several TRICARE programs available depending on your status and your location. Prior to the 1980s, there were basically 2 ways the military personnel, retirees, and family members received military health care. military members receive treatment at a military medical facility, and retirees and family members receive free treatment at military medical facilities, or they could use a program known as Civilian Health and Medical Program of Uniformed Services, CHAMPUS. They could receive government-subsidized medical care from civilian providers. Nowadays, TRICARE is a healthcare program of the United States Department of Defense military healthcare system. It was formerly known as CHAMPUS. Over the past few years, more TRICARE health program plans options have been established. TRICARE Prime is the healthcare option that is available to active duty service members and their family members. In overseas locations, TRICARE Prime is available only to the active duty service members and their command-sponsored family members. When you enroll in TRICARE Prime, you generally get most of your routine care from a primary care manager that you've either selected or been assigned. Where you live and the military hospital clinic capacity levels determine whether you have a civilian primary care manager or one at a military hospital or clinic. TRICARE Dental is the dental plan that's available to military members and their family members. It is administered by MetLife. We have TRICARE Vision, which may include eye exams and other services to find or treat an eye condition. Your eye exam coverage depends on who you are, your age, and your TRICARE program options. Lastly, we have TRICARE Pharmacy Program, which provides prescription drugs you need when you need them in a safe, easy, and affordable way. Now, TRICARE Prime is not free, so active duty family members and traditional survivors, which are surviving spouses during the first 3 years and surviving dependent children worldwide, have no yearly enrollment fees. But retirees and their family members and others per FY 2017, which is October 1st through September 30th, is $282.60 per individual or $565.20 per family per month. We have TRICARE Reserve Select, which is for reservists and National Guardsmen. That cost is $47.90 per individual or $210.83 per family per month. So you can see TRICARE is a pretty affordable healthcare program. I currently know several members who still stay in the reserves just so they can have their TRICARE Reserve Select. While there are many benefits that the military members are entitled to, I hope that you've gotten a good concept of home ownership, education, and healthcare plans that the military members have access to. Without these benefits of these programs, I highly doubt we would have the all-volunteer military members that we have today. Thank you.